appreciate the opportunity to be here to address the FDA. Most of you have been coming at this perspective of changing the nutritional label from a nutritional and scientific background. I think I'm the only speaker who will be here today speaking from a product safety and communication background. I am Dr. Gerald Goldhaber. I'm a warnings expert with over 36 years experience designing and testing product warnings and safety instructions for products that contain hidden hazards. These are hazards unlikely to be known by consumers and product users at either the time of purchase or during use. I have designed or evaluated warnings for products including Playtex tampons, Otis elevators, Rheem water heaters, Dr. Pepper, 7-Up, Cadbury beverages, Nissan Foods, S.C. Johnson's, Raid, Off, and dozens of other products. I've testified many times before Congress, as well as the CPSC, the Consumer Product Safety Commission, for whom I've consulted many times. I've testified in several hundred product liability cases on either the plaintiff or the defense side. My research in this area has resulted in dozens of books and hundreds of scientific articles. I've developed a standard method for the design and testing of product warnings taught by the Human Factors and Ergonomics Society, and I recorded the official course on safety warnings for the National Academy of Continuing Legal Education. I appreciate the opportunity this afternoon to present my opinions to the FDA related to your proposal to change nutritional food labeling. I am going to limit my remarks, however, to products containing added sugar. In my field, as I've said, a warning is needed for any product containing a hazard known to a manufacturer but not known to a consumer at the time of purchase or use. We call this a hidden hazard. Let's apply this theory to products with added sugar. That added sugar is a national hazard is widely accepted by the medical and scientific community as well as the public. Most people who understand that too much sugar can lead to weight gain and various diseases like obesity, type 2 diabetes, and heart disease are not, however, aware of the severity of the hazard. For example, as you heard before, 1/3 of Americans and 20% of children are obese, at least 30 pounds over their desired weight. 25 million Americans are diabetic and another 80 million are pre-diabetic. These are your statistics from the FDA. And 250,000 Americans die every year due to diabetes and disease related to diabetes. This is 10% of the annual U.S. deaths, according again to the FDA's own statistics. This costs our health industry $175 billion a year in direct costs and $70 billion in lost productivity. That affects everybody in this room. The risk of death from a heart attack, as Dr. Who told us, is 2 to 4 times higher among diabetics. According to Dr. Who's study, 25,000 deaths a year are due just to sugary drinks. And I'm sure most consumers know, if not these statistics, the general conclusion that sugar is bad for us and can help make us sick. But my contention is that we don't know how bad is bad, both in general and with our own personal diets. And that's because the food industry is speaking Greek. They are not communicating in clear English to us the exact nature of the risk of eating added sugar. We speak English, they speak Greek. We consume 80 to 90 grams of added sugar a day. Now, if I told you that meant 20 to 25 teaspoons of sugar a day, instead of telling you the grams, and this amount of sugar is 3 times the amount a day you should consume as a maximum. And remember, 0 grams is needed. That might just get your attention. If I started to list the number of teaspoons of added sugar in all products, for example, you know I was supposed to bring this in here, but I bought this Coke during the lunch hour, 20-ounce Coke. It has 67 grams of sugar. That doesn't mean much. How many teaspoons that is? Well, it's about 17 teaspoons. If I said to you, have a cup of coffee this morning, how many teaspoons of sugar? And I started to put 17 teaspoons of sugar in your drink. That might get your attention. If you took 3 Gatorades a day at 15 teaspoons of sugar per Gatorade, that would give you half a pound of sugar a day, or about 150 pounds of sugar a year. What I'm suggesting to you very specifically is change the label from grams to teaspoons. Teaspoons is English, grams is Greek. We speak English. Shouldn't there be a warning on products with large amounts of added sugar? When you consider that we have a hazardous condition that is known to a manufacturer, the food industry, but not necessarily known to the consumer. And that's the criteria for warnings that I stated above. The answer is, without a doubt, yes. What should the warning say? Warning: this product contains a significant amount of added teaspoons of sugar, which studies have linked to obesity, type 2 diabetes, cardiovascular disease, and certain cancers. Consult your physician about an appropriate diet with a reduced amount of added sugar. I am totally committed to informed choice, 100% committed to informed choice to our consumers. Adding this warning to products with significant amounts of added sugar and changing your nutritional labeling from reporting grams. By the way, 5% of America, according to our national studies, understands the metric system. 5% FDA, 5%. And yet we're reporting in metrics, Greek. Change it to teaspoons, and you will give the consumers informed choice. I thank you very much for your time.
Thank you for your comments. We'll go to our next.